So can you imagine hearing the words, "Help, I've fallen and I can't get up"? Pretty terrifying, don't you think? Imagine if that was you, actually. So back in 1989, there was actually an ad on TV that was about a medical service for the elderly in case they fell and they couldn't get up. We got to talk about that. Let me get you a cup of coffee and I'll meet you over there. So actually, it's not that funny. Help, I've fallen and I can't get up. That ad was so successful for the next 3 decades. People were saying to themselves or to each other, "Help, I've fallen and I can't get up," as if it was kind of funny. But actually, it's not that funny. It's actually a very truthful way of how people develop sarcopenia. Take a look.
I've fallen and I can't get up.
We're sending help immediately, Mrs. Fletcher.
So what Mrs. Fletcher obviously didn't know was how could she make it so she doesn't need that kind of service? We all want some sort of insurance. But how could she know that she's strong enough that if she falls down, she'll always be strong enough to get herself up and never be in that situation? That's what I want to talk about. And for that, let's go look at a few things. But before that, I want to say, I got you some coffee. I don't know what you want in it, so I just left it black. I hope that's okay. Okay, so this is what I want you to know. Help, I've fallen and I can't get up. I hope that never happens to you. And so the point of this particular video is to make sure that that doesn't happen to you. So that this never happens to you. But we need to understand why that is actually a fairly accurate representation of how we get older for many people, unfortunately. This is what I want you to know. How muscle mass loss, sarcopenia, actually happens as we get older. It doesn't happen as a straight line. It happens from event to an event to an event, episode to episode to episode. What are these episodes? You are laid up. You have an accident. You have an operation. You have a bad cold and flu. You have COVID. And you're locked inside and you're not going outside for whatever reason. Your activity, whether that's a sport you're doing or simply walking around the block or going to the gym ideally or doing exercises at home, is not happening as much as it did before. Or maybe it's not happening at all. If you're in bed and you're laid up, obviously it's not happening at all. So two things happen there. Usually when you're in bed, you lose your appetite, so you're not eating the amount of protein you need to eat, and you're obviously not exercising. 2 big losses. So this is called the catabolic crisis model of age-related loss of muscle mass. Muscle loss is accelerated in older adults during bed rest. That is it. That is it. Muscle loss is accelerated in older adults during bed rest. This comes from a study back in 2012, so it's not that long ago. So what you find is that you're going along fine as you get older, right? This is 40 to 80. Could have started 20. And you have an event, whatever that event is. You went skiing and you tore your cartilage and suddenly you're not being able to do all the things you do and you're hobbling around the house or you're actually laid up and people have to support you. Sounds like I'm talking from experience. I'm not. My dad did that. And so you eventually get back partially, you have greater mobility and you heal, but you're not as strong as you were before. You've lost considerable amount of muscle mass. So unless you exert the difference from where you were before to where you are and just getting around, you will be at a continually lower level. And then the next thing's going to happen. And you'll be at a continually even greater lower level. So it takes that effort. And the effort to come back to the level that you were at before the event, of whatever that event is harder as you get older. That's just the way it is. Or if you want to look at it another way, it's a greater responsibility. The responsibility of you taking your time and effort to grow your muscle mass back by the appropriate amount of protein and by exercise, specific exercise, is a greater responsibility as you get older. Okay, let's look a little more deeply. So, healthy young, 28 days of inactivity. This is a great study to read and go deeper with. 28 days of inactivity. Basically, they're in bed, maybe going to class, maybe not much at all. 10 healthy elders, 10 days of inactivity. So what they find is far less time, you notice that, but the muscle mass that was decreased in the older group was 10% of lean leg mass. That's your quadriceps. In a younger group, it was only 2%. 28 days and only 2% of lean leg mass. So what's the summary? The summary is they lose 3 times more muscle mass in 1/3 the time. So to put it another way, they had a 10% loss of muscle mass, which was the equivalent of a decade of muscle. Equivalent of a decade of muscle because they had 10 days of inactivity. That's the point of the crisis model of sarcopenia. Let's look at it another way yet. Early life, adult life, older life. Yes, we know we have that muscle loss, but the trajectory is really up to you how much you want to involve yourself. It's both physical and it's both nutritional. The range of muscle mass strength in individuals will decline, but it doesn't have to decline that much. Environmental changes can lower the disability threshold. What does that mean? Those who go to the gym, that's their environment. It's what I call behavioral nutrition. It's something you do to yourself. It's not so much you're eating, what you do to yourself. Are you active? Are you not active? Primarily, that's the question. So there's really only 2 things as we get older that make us get older faster. One is insulin resistance, and the other is loss of muscle mass. They clearly go together, but the loss of muscle mass, inactivity, is a voluntary, other than you being laid up and incapacitated, is a voluntary, it's a choice. You can not be active or be active. If you're not active, you're not going to have the muscle mass, which is going to help you regulate healthy glucose levels for the rest of your life. That's why more and more people, as they get older, become diabetic, become insulin resistant. It's not so much their diet, but it's clearly that's a big culprit now with processed foods and everything else, but it's their declining muscle mass, because your muscle is your largest consumer of glucose, serum glucose in your whole body. It's your biggest customer. It's your biggest appetite. And so when you work out, you're just sucking in or getting rid of, or however you want to look at it, your extra glucose. You're really helping to maintain a very tight range of healthy glucose levels. That's where muscle mass comes in, if you think of it that way. Here's cross sections of 40-year-old athlete, 70-year-old sedentary. Look at that decrease in muscle. It's like clearly he or she has a limited ability to regulate their glucose. And then you have a 70-year-old athlete. They clearly have a big ability. Look at all that muscle mass. That's going to help them really keep their insulin resistance from happening at all, or a very narrow range. So the question that always comes up, am I too old? Am I too old? I hear that at 25. I hear that at 40, 50, 60, 80, you're not too old. There is no such thing as too old. You start here now and you go forward. So where are we in this? Yeah, we're going to eventually have some decline. It doesn't have to be this severe. It's up to us how we want that trajectory to look like. First, where are most people today in terms of daily protein consumption? This comes from Ireland. So the National Audit Nutrition Survey skewed protein distribution in middle or older age Irish adults. So what does this mean? This is basically how they actually eat over the course of the day. That's animal versus plant. And the reason we break it down that way, the study breaks it down that way, is because the concentration of leucine is far higher in animal protein sources than it is in plant protein sources. And then there could almost be a third level here if you wanted to break it down. It's like, so how much of that was processed foods? And that would really change everything. But right now it's animal or plants, right? 2 different age groups, 51 to 64, and then over 65. And what they find is either group just had one event that they ate enough protein that triggered muscle protein synthesis. We went over that in past videos, and I'll review it briefly coming up. But one event, they should have 4. And if you're a bodybuilder, 5. 5 eating opportunities, 5 eating events in which you exceed the amount of protein. You hit the trigger. You exceed the amount of protein you have to eat to trigger muscle protein synthesis. So here, it's only 1. No wonder. We have a big reason why there is sarcopenia among the elderly. They only have 1 trigger. And as you can see, as they get older, from 51 to 64 to over 65, that barely makes it into the range to trigger. So you can bet there's plenty of elderly that don't have any meal time or any eating opportunity or occasion that triggers muscle protein synthesis. Okay, here's for men and for women, based on your ideal body weight, which is not the weight you have to be. I don't weigh my ideal body weight. We're using this as a reference. It's about height and gender and a little bit about age. And so we look at, here's a height, that's obviously the gender. There's a height, there's obviously the gender. So we're looking at my height, 5'10" inches here, and you could do centimeters. Also, I didn't do that here. 162 pounds is ideal. That means on 1 gram of protein per pound of ideal body weight. This is what I should be eating in the course of the day. In order for me to eat enough to trigger muscle protein synthesis, this is how much I should eat at least. So my snack should be at least 30 grams of protein. So the range is ideally, when we talk about this amount of protein here, I get this all the time. I go by 1 gram of protein per pound of ideal body weight, which equals 2.2 kilos, 2.2 grams per kilogram of ideal body weight. But the range is 1.6 to 1.2. You know, this is where all the research is. I put it at the higher end, and I feel I'm doing fine, and it was a big deal. I too had to rethink how much protein was I having. So this is only a reference, and you can use to calculate your daily protein requirement. And the minimum amount of protein to have to stimulate the greatest muscle protein synthesis, to trigger muscle protein synthesis, is this column right here. So think of 5'10" male, 30 grams of protein is what I need. Okay, here's just an example of, and I put another example of past videos. So we say, all right, 6 ounces of ribeye, something I never eat. Lamb chops, maybe. Pork tenderloin, often. Chicken fillet, often. Turkey breast, periodically. Beef jerky, sometimes. Fish. So what you see is, how much of this do I need to eat to at least get my 30 grams, right? My 30 grams of protein. The tenderloin, the others were higher. I just need to be aware of having enough on a per trigger eating occasion. And of course, I put down dairy, which I don't have. I have plenty of eggs, of course. I don't do protein powders, but protein powders have their place. If people are laid up and they're in bed and they don't feel like eating, at least they can have a shake and have enough protein that way. They're not going to get the physical activity, but they can certainly get the adequate amount of protein. So for those occasions, absolutely, protein is a viable alternative. So here's what we're looking at. Without meeting your daily protein requirement, you will have a net protein loss. Unequivocally, you will have a net protein loss. This is what it looks like. You eat protein, you get a little bit of MPS. But when you're not eating protein, you're going to have more breakdown. So this is greater breakdown, muscle protein breakdown, then there's muscle protein synthesis over time. That's sarcopenia. Okay, once you meet your daily protein amount that I've showed you, everything changes. Now you're doing greater protein synthesis and less muscle breakdown. Pretty straightforward. Are older adults trainable? Strength training, meaning in strength training. Trainable, goes in a whole nother directions. We're talking about strength training. So strength training over 85 years old increases muscle mass and strength. 12-week strength training in over 85 and over year olds, 44% increase in lean muscle mass per image, 134% increase in basically its muscle mass. You can see the difference between before and after. Also think of the effect of this on their ability to maintain their healthy glucose levels. The ability after the 12-week program clearly went up, 1999 in muscle nerve. Okay, some work is involved, but not much really. Here's Judy, here's myself. We go to the gym 3 times a week, twice for HIT. We've talked about that before. Okay, create a demand for muscle protein synthesis, MPS, exercise, high intensity training, slow, high intensity weight resistance training, or slow, high intensity training, SHIT. It's necessary, and it's hard, but it's not very long. So this is impressive, 2015 study. It's a Dutch study, by the way. There are no non-responders to resistance type exercise training in older men and women. There are no non-responders. In other words, everybody benefits. Everybody benefits. So conclusions of this was that the level of responsiveness was strongly affected by the duration of the exercise intervention, how long you did it, meaning days, weeks, what they're talking about, as opposed to hours in the gym, with more positive responses following more prolonged exercise training. We conclude that there are no non-responders to the benefits of resistance type exercise training on lean body mass, muscle fiber size, strength, or function in the older population. Consequently, resistance-type exercise should be promoted without restriction to support healthy aging in older population. There are no non-responders to resistance-type exercise in older men and women, and this just goes in at length about that. When you add your slow resistance HIT, your muscle protein synthesis screams. And there you go. You've now just extended your MPS and you've minimized your muscle protein breakdown. The benefit is greatest for the people with least activity. In other words, if you haven't done anything, just doing something is going to make you just jump out of the box. This is basically a graph. So if you're working out on a regular basis and you now are more focused, yes, you will get an increase. So it really depends. If you're talking about Olympic athletes, they're probably not going to get much of an increase because they're already doing it. So it's open to everybody. The point is, just start and you'll get your biggest change. You're going to go, oh my gosh. Yeah, you'll feel sore for a day or two if you haven't done anything for a while, but you're going to go, oh my gosh, you sleep better, you feel better, there's somebody giving you a new brain, all those things. Does it work? Protein-enriched diet with the use of lean red meat combined with progressive resistance training enhances lean tissue mass and muscle strength and reduces circulating IL-6 concentrations, which is basically inflammatory biomarker similar to CRP, concentrations in elderly women, a cluster randomized control study. So the conclusion was, at 1.3 grams per kilogram of ideal body weight achieved through lean red meat. So the red meat was more concentrated in terms of the leucine. Leucine clearly is part of that. And you can even go into Chronometer and you look up, how much you need. And basically you need about 3 grams of leucine per eating occasion. So for your snack, and you'll find that as much as you go, oh, well, I should be having, whey protein concentrate. Well, only if you're laid up in bed, because if you'll find out that lean red meat has enough leucine. 30 grams of lean red meat will have enough leucine for you, or fish, or this or that. So it's really nothing you really have to put into the calculation if you're using whole food sources of protein, whole food animal sources of protein. It's not true for plant sources. So it's safe and effective for enhancing the effect on progressive resistance training and on lean tissue mass, muscle strength, reducing inflammation, we'll call it, in elderly women. The effects of a protein-enriched diet with lean red meat on muscle and cognitive health and function in older adults. So this says age-related muscle wasting has been strongly implicated with falls and fractures, and that's where we started. Help me. I can't get up. But it has also been associated with cognitive decline and dementia. Cognitive decline and dementia. Progressive resistance training, PRT, and adequate dietary protein are recognized as important contributors to maintenance of muscle health and function in older adults. So both factors also have the potential to improve brain function, to prevent cognitive decline via several pathways. 2 of them are, which we've already talked about in previous videos, is increases insulin-like growth factor, IGF-1. We've talked all about that. Brain-derived growth factor, BDNF. You bet. These are important effects. See the video that I've done on this called Ultimate Secret. You need to increase your muscle mass with growth hormone. What I mean when I say growth hormone is IGF, growth hormone naturally in 15 minutes twice a week. So the key questions, well, I'll get into later really about leucine, is like, does a high protein leucine rich feeding pattern alter response to concurrent exercise training in older adults? Leucine rich, if you just eat whole food sources of protein, we'll go into a little more detail later, but my short answer is whole food sources of protein, don't worry about it. What is the effect of high protein, leucine rich feeding in the pattern in the absence of exercise? Many of you just rely on protein. If you're just relying on whole food sources of protein, that's a big, big deal, given what I've just shown you. Throw in exercise is even a bigger deal. To be talked to be continued. So what you see now is that as we get older, sarcopenia, for one, is not automatic. There's stuff you can do to reverse it. It's the amount of protein that you need. We've talked about that. It's resistant exercises. We've talked about that in previous videos. But I want to show you how important being laid up is detrimentally. So whether you're in the hospital because of an accident, because of an illness, you had COVID, Whatever the reason is, the reality is you were laid up and you were bedridden, and that inactivity by itself is a factor. And they call that catabolic crisis, as we've talked about. So you're having one catabolic crisis that you recover a little bit from, but as you get older, the amount of work you have to do to bring you back to before you were laid up in the hospital, in bed for a week or 2 or 3 or whatever, takes a lot more effort than it did when you were decades younger. So what does that mean exactly? It means that you really ought to be thinking about working out on a regular basis. That is, when I say working out, I mean HIT, right? High intensity training, resistant exercises, slow resistant exercises to build your muscle protein synthesis. You really need to look at that as your insurance policy. That is your insurance policy. Your muscle mass you created will carry you through those downtimes. And then when you are laid up, if you really can't eat and you feel it's too much for whatever reason, well, that's when you would think about various perhaps protein powders and so on to get that protein in, even if you're not able to eat that well, or you're not interested in eating fish, poultry, pork, whatever. So that's the secret. It's a little bit like your emergency fund that everybody's told to have since they were 20 years old. Have an emergency fund, in case something happens. Well, when you're younger, you never think in case something happens, so you never have an emergency fund. But as you get older, if you have a little bit of discretionary income, you need to put it to a side so you can grab it for those times. That's what muscle mass is. That's exactly what muscle mass is. You have that, and when you do have those down times, you don't fall as far for your age group. And so by doing that and then getting back on your feet is really important. Another way of looking at this is when you probably heard about when people go in the hospital, how quick they are to get people out of bed, right? Oh yeah, this person has brain surgery or whatever else. They had her up and walking, had him up and walking as soon as possible. That's the reason they do that, is to activate that muscle. Obviously not going back to the gym, but minimizing that downtime, minimizing the time that you are laid up is really important. By the way, you're not having any coffee. Well, you think I put something in it? It was black. Till next time.
I've fallen and I can't get up.
Help is on the way, Mrs. Fletcher. So if this is something that you're interested in, that is a topic that I obviously go deeper in terms of labs, in terms of how to do it, in terms of why you would want to do it, various topics, as you've seen that I've done in the past, then please let me know below in a comment. Till then.